guys, so this is the last part to the first group presentation labeled Integrative Theories of Schizophrenia and Learning. So I'm going to take it from the PowerPoint slide labeled Latent Inhibition and Schizophrenia all the way to the end. So latent inhibition means that it's easier to learn a new trait than to unlearn a trait you've already known. It was first discovered by Lebow and Moore in sheep and lamb, and since then has been rediscovered several times in other mammals, which also include humans. So, latent inhibition depends on the stimulus, the response, and the condition inhibition. One study where rats were injected with dopamine to trigger a psychosis-like state showed that blocked latent inhibition, and because of that study suggests that schizophrenic people may also lack latent inhibition because of their dopamine levels. Moving on to the next slide is common blocking and prediction error. So common blocking is the lack of full connection between the unconditioned stimulus and the conditioned stimulus. So this could depend on a few things, like the intensity and salience of the conditioned stimulus or the unconditioned stimulus, and the contrast between the two, between the conditioned stimulus and the unconditioned stimulus. Common blocking can be broken down into three main contingencies, which are physiological, judgment, and behavior. And prediction error is the difference between the stimuli strength and the possible stimuli, the total stimuli strength and the possible stimuli strength, and that determines if learning will occur or not. Moving on to the next slide, the relationship between common blocking and schizophrenia. So common blocking was shown to be disrupted in acute but not chronic schizophrenics and their judgment. So common blocking is actually similar to latent inhibition, which is why they decided to test it on schizophrenics and schizophrenic patients in the first place, because it follows the same path. So the study that they did not confirm evidence between the relationship of the severity of schizophrenic and common blocking, but it does show more in acute. It does show in acute schizophrenics and not chronic. So the last slide is the conclusion, and learning theories have been used to understand schizophrenia for a long time, using neurological field and other fields as well to tie it all together. So both the past ideas and the present ideas help a lot to try to figure out this disease fully, and yeah, thank you.